Mrs. Phillips. I'm Bailey. I'm going to be your nurse today, and I'm just going to check you out real quick, see how you're doing, see what's going on with you. I'm going to wash my hands and I'll close the curtain. I'm going to fill out my case in. Okay, let's see. Can you give me your name and date of birth? Alright, and let me check your wristband. Okay, good. Got our whiteboard with the correct names and date. You don't have any oxygen in, don't have any feeding tubes, no abdominal tubes or wounds, drains, no chest tubes, you don't have a trach, and it looks like you do have an IV running. Looks like it's supposed to be running at 100 milliliters an hour of normal saline with a continuous infusion. Okay, and that's in your right arm. I'm going to look at that. Just want to see if there's any tenderness, pain, or swelling in there. Any drainage. Looks good. Okay, we've got the correct drug, the correct time, dose, and route. And we have the label and date of what's hung. Okay, and we got side rails up, 2 side rails. Bed is in low position, call light is within reach. There's no clutter, obstacles. Patient's assistive devices are within reach. Water pitcher cup / urinal. If they're male, well, you're not male, but toilet or commode at the bedside. Looks like it's empty, and trash bag. Alright. So I'm just going to go ahead and do a little assessment on you. Alright. I'm going to look at your face. I don't see anything that looks, everything looks symmetrical. There's no drooping or anything of the face. I'm going to feel your pulses. Okay, and the pulse rate was 122, which is really high, or is a little bit high. We'll look at their respirations. Okay, respirations are at 22, and I'm going to check your blood pressure. Okay, blood pressure is at 92/58. And then your pulse ox is at 92%, and your temperature was at 103.6. Okay. And I'm gonna felt this while I was feeling the pulses. I checked the temperature and what the skin looked like. It was warm and dry. I'm gonna check turgor. Turgor's elastic. I'm going to listen to the lung sounds. Okay. Alrighty. Okay. And okay. So my patient, she is a little bit confused. She has an altered mental status. Okay. And now can you pull away from me, push towards me, and squeeze my hand. Okay, wiggle the fingers. And I'm going to check cap refill. Cap refill is good. There are a little bit of weakness in the extremities. Okay. Respirations were a little rapid, slightly elevated. Are you having any pain or anything on your upper extremities, or any numbness or tingling? Okay. Are you having an abdominal pain that I need to know about? When was your last bowel movement? Right. And are you having gas? Right. I'm going to go ahead and feel your abdomen, palpate. If there's any tenderness, just let me know. Okay, I'm going to go ahead and listen to those bowel sounds. All sounds sound active ×4. I don't feel any distension. There might be no distension in the abdomen, or nothing's rounded. Are you having any problems going to the bathroom? Okay. Is there any pain or discharge that you've noticed when you go to the bathroom? Okay. So the patient did find that the patient has foul smelling urine and it is cloudy, and she did have an incontinent episode. So you may have an urgency or frequency. Any tubes or anything you have fully in. Alright, and then I'm going to go and look at your legs. Legs look good, skin's nice and warm. Check out your feet. Can you push towards me? Pull away from me. Wiggle the toes. Check cap refill. Okay, cap refill is good. Less than 3 seconds. There's a little bit of weakness in those lower extremities. And then I'm going to feel those pulses, pedal pulses bilaterally. Okay, and those are both present. So were the bilaterally, the upper extremity pulses were present as well. Okay. And then we already checked your IV, made sure that there wasn't any infiltration or anything. Alrighty, Mrs. Phillips, I will come back in later and we'll see if you've improved at all or anything.